Do you want to learn about psychological growth without sorting through the jargon? You're in the right place. This is the Relational Psych Podcast. I'm your host, licensed therapist Tyson Connor. On this show, we learn about the processes and theories behind personal growth and experience a little bit of it ourselves. This is Season 2, where we'll focus on the practice of relational psychotherapy and explore concepts and theories that consider psychology from a relational lens. And please, keep in mind that this podcast does not constitute therapeutic advice, but we might help you find some. And today, my guest on the podcast is Don Schimmel. Don Schimmel is a clinical psychologist and psychoanalyst based in Mountlake Terrace, Washington. He has over 50 years of experience working with adults, children, adolescents, families, and couples. He's a senior faculty member at the Seattle Psychoanalytic Society and Institute, teaching seminars on self-psychology, relational theory, intersubjectivity, Freud, and object relations theory. Don also leads classes on treating children, adolescents, and their parents, and provides ongoing individual and group consultation to psychotherapists in the Northwest. Don.
Thank you.
Welcome to the podcast.
Thank you. Good to be here.
So today, we're going to be answering the question, how can adolescents benefit from psychodynamic psychotherapy? So what do you think?
What do I think? Well, most adolescents that are struggling, while they may not be consciously aware of it, are usually struggling to separate in some ways from their parents.
Mm-hmm.
If you think about it, kids, for the first 11, 12 years of their lives, are still very tied into their parents.
Mm-hmm.
And there is a normal, as most people know, a normal period of time when adolescents need to separate. And there's no way of preparing adolescents for that. Some adolescents have an easier time and some have a more difficult time.
Mm-hmm.
And so one of the ways they benefit from psychotherapy is they have an opportunity to, it's a kind of specialized relationship. It's different than parents because unlike parents, who are invested in a parental way and are easily spooked and scared, when they see their kids, moving away from them and exploring things that sometimes are a little dicey. That therapists, while they're certainly susceptible to having those feelings, usually because it's not our own kid, we're usually able to sort of step back and listen in a very unique way.
Yeah.
And so one way of thinking about the relationship between an adolescent and a psychodynamic therapy is that the therapist is to the adolescent the way that a blankie is to a toddler.
Huh.
It's we are a kind of transitional figure, or what they called transitional object.
Right.
Yes, and so it's different in that sense.
Yeah.
Is that we help to usher them into adulthood.
Yeah.
Yes.
A couple things that I want to clarify for the listeners that I think are relevant from what you've said already. Well, also, listeners, I might get really excited this episode because I love working with adolescents. And actually, it might be helpful for us to define what we mean by adolescence, especially
Yeah.
in the context of like a psychoanalytic theory, because psychoanalysis is a developmental theory. So we think about people in terms of where they develop over the course of a lifespan and what sort of processes and emotional and cognitive things happen at different stages of a person's life. That's a big part of how we think. And so adolescence is, at least to my mind, I'll give you my definition, then maybe you can refine it because you've been doing this longer than me. But I think of adolescence, like you said, as being largely defined by the period of someone's life where their sense of self and sense of identity, it's transitioning from primarily being about their relationship to their parents to being instead about a more independent kind of sense of self, and largely defined by their relationship to peers and to other like other cultural groups, subcultural groups, but it's about that process of separating from like primarily being a member of the family to primarily being sort of an adult who's
Yes.
defined by other relationships.
Yes, absolutely. And one of the things you said, which I completely agree with, is that it's a move away from the parents to the peer group. The peer group becomes the group who has the most amount of influence, which is why so often parents, understandably, when they become concerned or alarmed about their teenage kids, at times want to control who it is that the adolescent is hanging out with, because the adolescent has so much power and so much influence. Prior to adolescence, even what we call pre-adolescence, which is right around 10, 11, 12 for some people, the parents' influence is still the most potent.
Yeah.
And the closer to around 14, 15, 16 years old, the more parents have nothing intelligent to say to their kids.
Right.
And so it's tricky when a teenager comes to see an adult therapist. Often they'll say to their parents, and they'll say to the therapist, to me, is say, "Why would I want to talk to you when I can talk to my friends?" You see, and one of the ways, if I can get into this a little bit, is one of the ways that I respond to that is not to get into a power struggle over whether that's true or not.
Yeah.
But to find a way of playfully validating that by saying something like, "Yeah, why would you want to talk to yet another adult that doesn't know half as much as your friends," or something. And that's a way of communicating playfully that I take you seriously, and that I respect the sort of place in your development without saying that.
Yeah.
And usually, by not getting into those sort of power struggles, what happens is that kids are able to then, over time, sort of, use me as a transitional figure.
Yeah, so let's define that a little bit deeper. That idea, listener, if you want to do some Googling, that idea I believe comes initially from Winnicott,
Yes.
who was an object relations
Yes.
Psychoanalyst.
Yes.
And his idea of a transitional object. Let me see. It's been a while since I thought about this. So again, refine my rough description. The idea of a transitional object, like the toddler's blankie, is an object, and in this theory, an object could be a literal physical object, and for this analogy, it'll be the blanket, but it can also be relationships, or it can be ideas or group memberships. So any kind of like thing that has a real importance in someone's mind is an object. Again, very rough definition, but a transitional object is this thing, like the blankie, that is soothing and comforting and is experienced as both an extension of the self and separate from the self at the same kind of time.
Yes.
Like your blankie when you're 4 is your blankie. And it's a thing that you can carry around and you can throw in the crib if you want to, or if you're 4, you probably have a toddler bed at that point. You can throw under the bed, whatever. But if it's missing and gone, there can be a panic to it. You need your blankie because it's like it's a part of you that's missing.
Yes.
And it sounds like what you're suggesting is that for an adolescent, they still need transitional objects as they develop their sense of identity. And they need those to be in relationships with living people, not just with objects or video games or whatever else. And that a psychotherapist is in a position to be that intentionally. Someone that they can talk to, someone they can be themselves with, who's both separate from them and different from them, but also someone who can be at that like close experience of self that's so vulnerable, which is really scary, especially for a lot of adolescents.
Yes. I'm glad you also help me, guide me back to that concept of the panic, because I have something that sort of helps to validate that very thing that you're saying. But what I wanted to add to what you're saying was that Yes, it's Winnicott who talked about the transitional object. One of the things he said about the blankie is that the blankie is imbued by the infant and child with the power of both the self and other. That it isn't specifically a representation of, say, mom. It's a representation of mom with me. It is us. It is us, and so that is the concept, and it's the relationship that it represents.
Gotcha.
And so what happens is that they are taking the relationship with them, and when they're ready to give up the blankie, usually what it suggests is that they are ready to move beyond that stage, that infant toddler stage, if you think about the infant knows no boundary. The infant is in the mind of an infant, the infant and mother are extensions of each other, and so there has to be some transition away from that. And if it's too abrupt, it can be traumatic, and the child develops what they call an insecure attachment.
Right.
And so, being able to allow for transitional objects without questioning it is one of the things that Winnicott really stressed. Is you don't question the transitional object, the blankie. You don't say, that blankie represents us. You don't do that. It's something that just simply happens, but what I was going to say about the panic was that it's interesting because, well, I don't work with a lot of little kids anymore. I'm mostly working with the little kids who are now teenagers.
I like that. I'm gonna borrow that.
A lot of these people I started out with when they were little, but what I noticed was that I imbued the toys with magical powers the same way that the kids did. And so I noticed that if I would go into my toy closet and I couldn't find a special toy, I would find myself panicking. And I would stand back and, why would I panic? These are just toys. Well, they're not just toys. They're imbued with magical powers.
Yeah.
You see.
Yeah.
And so going back to adolescence is one of the things that you never do with an adolescent for developmental purposes is that you never draw attention to the relationship unless they bring it up. Now, this is different than work with little kids and with adults. Little kids declare they love you and how important and how they need you and how they want to come in every day. Some adults, come to consciously value the relationship they have with us.
Right.
Adolescents are the developmental imperative of an adolescent is, I don't need adults.
Yeah.
I need my friends. So the last thing that I do, and most adolescent therapists hopefully, is we don't draw attention to the relationship. So, for example, if I'm going to take a vacation and a teenager says to me, "That's fine, good. I'm glad you're taking a vacation. I can get some homework done or something." I don't try to process that with them, because that's too close. I accept the idea that they don't need to be with me. And I'll give you an example of that. A great example. I once saw, years and years and years ago, I saw this older adolescent who came in a major, major, major crisis. And, we talked about it a little bit. And then about 2 weeks later, he said to me, I'm feeling a lot better now. I don't think I need to come in anymore. And I said to him, you are doing a lot better. But you know what? Why don't we just keep meeting anyway? And he says, okay. And then we proceeded to meet for another probably year or so. If I had said to him, you really do need me, we really just, scratched the surface here, he would have defended his position.
Yeah.
And it wouldn't have been something that was pathological, it would be actually a good sign that he is struggling to separate from those infantile attachments.
Right. I feel like that's such a common thing to see and to talk to parents about. I'm imagining a listener of this episode who maybe is a parent considering therapy for their kid, and our topic is psychodynamic therapy for an adolescent. And so often in conversations with parents, I find myself framing the symptoms or like the behavior that's bringing in them into therapy in the first place in terms of like healthy development. Like, yeah, it feels bad. Yes, it's caused trouble at home. And there's a way to think about this in terms of healthy development that does often boil down to just what you're talking about. The parents might know, like, no, like this is a boundary we need to hold, or yes, this is a thing that is important actually. But the child's response, the adolescent's response, can feel so wrong from an adult perspective that sometimes they say, is my child okay? Are they crazy?
Yes. Well, that reminds me of another example that I think again validates, I think, the very thing you're saying is that some time ago, and this has come up multiple times, where a parent will say to me, my son or daughter seems to want to hang out more with their friends now. I keep saying, hey, can we do this and can we do that? And I just feel like I'm a bad parent. He doesn't love me anymore. And what I said, it's a sign actually that you're doing a good job.
Yeah.
That most of the time, if you've started out life with a child that's good, they return to that when they feel separate, when they feel more separate.
Yeah.
That they need to push us away in order to be themselves, which means they don't want to hang out with us.
Yeah.
Sometimes,
And there's some, I think the thing, I don't know, I'm sort of processing this idea as I'm saying it, but I think sometimes parents, in my experience, seem to understand that sometimes it sucks to grow up.
Yeah.
Sometimes it sucks for the kid to grow up.
Yes, it's a big loss.
And sometimes my job is to tell parents, well, yeah, and sometimes it sucks for you when your
Yes.
kid grows up.
Yes, yes.
That's part of it too.
And this is why it's so important, in our work, to work with parents.
Yeah.
And this is one of the things that I do, is that when a parent calls, and it's 99.999% of the time, when a parent calls me up because they're concerned about their teenager and want to know whether I can see him or her, I always say that the evaluation starts with the parents.
Yeah.
And I will say very explicitly that it doesn't matter how good of a relationship that I have with your son or daughter, that you and I need to establish a very good working alliance, because a lot's going to go on and you're not going to know how to understand it or interpret it. For example, your son or daughter may come home and you may say, well, how'd it go in therapy? Okay. Well, did you talk about anything? No. That's why it's important to have periodic contact with parents, is so that they can understand the meaning of a comment like that, which is different than disclosing what it is that the adolescent and I are talking about.
Right.
But so that they can understand what it means for their teenager to be in therapy. They're not going to talk about it.
Right. Yeah.
And they're not going to say good things necessarily about it. They're going to sort of devalue it. They're not going to necessarily hate it, but they're not going to, hey, thanks mom and dad for doing this. It was the best thing you could ever.
Yeah.
They're going to at best you're going to get compliance. Yeah.
Compliance at best.
Compliance.
Yes. Setting expectations.
Yes. I once had a 11-year-old say to me, isn't it about time you meet with my parents? That's unusual. Yeah.
Somebody had a schedule.
Yes. Yeah.
So I'm imagining a listener who has an adolescent who someone's recommended therapy, maybe a primary care physician or a teacher, someone at school, something like that. And they're trying to figure out, okay, what kind of therapy should help my kid? And most likely they've been recommended for cognitive behavioral therapy or dialectical behavioral therapy around here, maybe EMDR if the kid has a history of trauma. But we each practice psychodynamic or psychoanalytic psychotherapy. What how is that different from those other kinds of therapy that a parent might be trying to figure out and to choose between?
Yeah. Well, that's what a lot of parents ask me. Even when the therapy is well underway, they will hear something about, my friend or neighbor said that, told me about dialectical behavioral therapy or cognitive behavioral therapy. And what I will say is that is that it's it really in some ways is apple and oranges, and what some people really gravitate to apples and some people gravitate to oranges.
Yeah.
My view on it is that, as I said earlier, is that what a psychodynamic therapist offers is a specialized relationship, not a set of techniques. And this is different than not only DBT or dialectical behavioral therapy, cognitive behavioral therapy, but it's also different than classical psychoanalysis. I was trained in more of the classical psychoanalytic method, which I abandoned as soon as I possibly could, because what it does is it stresses the technique
Yeah.
rather than the relationship. And one of the historical criticisms of classical psychoanalysis is that people will say, I know it intellectually, but I don't feel it.
Right. Yeah.
And in order to feel things, you need to you have to do it in the context of a relationship.
Yeah.
There is this distinction in psychoanalytic theory between a one-person and a two-person psychology, and in the beginning, as in like the beginning with Freud and ego psychology, which is derived from Freud, is that everything was considered in the client or patient, and it was up to the analyst to listen and to make interpretations. And if you got the correct interpretation, then that would lead to cure.
Right.
And that if an analyst was trained correctly, that he or she would arrive at the same conclusion or interpretation. Okay, that is the modern view of psychodynamic therapy or relational psychoanalysis is that oftentimes there are multiple interpretations, and that for example, like with a dream, is like if somebody tells me a dream, I don't know what it means, but if I listen and I talk with the client or patient, together we will come up with a shared reality of what it means. Okay, how all this is different than DBT or CBT is that, to the extent that I understand it, is that the emphasis tends to be on what you do when you're in a stressful period of time. Is that you challenge your thought processes. If it's CBT, if it's DBT, the emphasis on, okay, what do you do instead of this other thing that you've been doing, which is self-defeating or self-destructive.
Right.
In relational psychodynamic therapy, whether it's with kids or adolescents or with adults, the emphasis is really on the relationship, and the assumption is that there are certain needs to be listened to and validated that have never occurred, and that when that occurs, then the person lets down their defenses and begins to expand their sort of self-knowledge. So this is a long way of saying that some people are more psychologically curious than others. Some people, they don't want to be given a coping skill. They want to understand themselves, and that person is going to benefit more from a relational psychodynamic approach than someone that says to me, what I'm really looking for is a set of coping skills. And then I'll say, maybe have you checked out DBT or CBT, because that's what they do,
Right.
and so that's kind of the difference. I think.
Yeah. So what I'm hearing you say is that at its core, a relational psychodynamic therapy,
Mm-hmm.
whether it's with an adult or an adolescent or a child, is about having a relationship that functions in that sort of transitional object way, where someone can feel like they have the experience of someone being with them, of having some need met, some anxiety soothed, some thing about them that isn't seen by other people, being observed or noticed or engaged with, some feeling of emotional contact, something in that long list of things.
Well, and one of the unintended consequences in explaining it that way is there may be some of your listeners who are going to say, well, why would I pay for a relationship? Well, it's not, it's a little more complex than that. The relationship, if it's a safe relationship, if it's a relationship that doesn't repeat a trauma, and the trauma can, traumas are on continuums. Trauma can be very, very small. Like, I've never been understood in my life. I've always been told what I think or what or what I feel. The idea that they can be in a relationship with somebody who actually listens analytically, and what I mean by that attempts to listen without prejudgment, or doesn't move in real quickly and give advice. It allows a person then to drop their defenses, because we all have defenses against getting to know ourselves and our real feelings, especially if we've grown up in a situation where maybe it hasn't felt so safe to do that. So
yeah. So if I'm a parent listening to this and trying to decide, okay, what kind of therapy is best for my kid, I'm imagining them hearing you describe, like, this could be helpful for that. And I'm imagining that person saying, oh no, my kid screwed up because I didn't meet their needs right. This is my fault. This is all on me. And we were talking before about the importance of having that relationship with parents from the beginning. Can you speak to that's such a common anxiety for parents? Can you speak to that a little bit?
Yes. All of the parents that I work with connected to the kids, the adolescents, go there, and I don't know how you could not. I think all of us as parents are tempted to blame ourselves, and I think that I mean, for example, I have a 31-year-old who just turned 31 the other day, son.
Congratulations.
And thank you. And and like all 31-year-olds, he struggles. We all struggle at 31. It's tempting for me to blame myself, but that's a little grandiose, because part of letting go is that it's not your fault.
Right.
And that it's not that we don't make mistakes, not the parents that don't make mistakes, but there's a certain point, I think, where in order to grow up, kids and then later adults need to sort of take responsibility for their choices. And so the other thing is that I tell parents is that not infants are not all born equal. And if you look at babies in the nurseries, some induce in us certain responses that reinforce certain behaviors, and others you really have to work hard. So some of it is just genetics,
right? And
there's a way in which genetics and the environment interact that often are missed, and so it's tempting to blame ourselves.
I also sometimes hear parents wonder, like, why do I need you to do this? Shouldn't I provide this thing, this whatever it is you're doing, this like being with experience? Shouldn't I be able to do that for my kid? And I find myself saying, like, well, like, yes, and you do all the time, but also because you're the parent, you can't. Well, they need to not be with you.
That's the whole point. Is that that the parent needs to be able to let go. It's like parents tutoring their kids.
Right.
It's like I always say to parents, if you can afford to get a tutor, it's too emotionally charged. They will often behave much differently with a tutor than with the parent.
Yeah.
Yeah.
And that's just trying to figure out, calculus, which is no small matter.
Yes.
we described what it is to work psychodynamically with an adolescent. This is what you can expect a psychodynamic therapist who works with an adolescent will provide. If I'm a parent listening to this episode, what kind of like symptoms or behaviors or like what kind of a person is psychodynamic therapy helpful for?
Yes, good. Yes, and by the way, there is a contrast here where in some cases psychodynamic is not the treatment of choice.
Yeah,
Let me start. Can I start with that?
absolutely. Yeah.
If somebody, for example, calls me up and says that I have obsessive compulsive disorder and I can't function,
Mm-hmm.
okay, unless they say to me, I've tried exposure therapy,
Yeah.
okay, and it didn't work, and I've tried this and I've tried that. What I'm tempted to do in that case is to say, get the symptom in control first, and then let's figure out what's driving it. It's a
Yeah.
little bit, it's analogous to medication, is that if you're so depressed that you can't get out of bed, the first thing is to get on the medication so that
Right.
you can think about what your problem is.
Yeah.
If you're so depressed that you can't get out of bed in the morning and you can't concentrate, you can't explore what's going on inside you.
Mm-hmm.
But that said, though, that typically the parents who are calling me, are saying, I've noticed that my teenage son or daughter is, they used to be motivated, they used to be happy, they're more aloof, they're not hanging out with their friends. Some of them will say that they've alluded to, oh, I wish I were dead. That's often a red flag for parents, and will call me. There are more significant problems that I get calls about. Like I discovered my child cut themselves or is cutting.
Mm-hmm.
They're using substances. They're skipping school. They're staying out all night if they're older.
Mm-hmm.
They're having problems with eating. They're eating. They seem to be getting skinny.
Mm-hmm.
They seem to spend a lot of time in the restroom, and I'm wondering if they're, if they're vomiting, they're purging, So there's all of these are reasons, or just parent-child problems.
Sure.
The child that says, you're too controlling, and let me have my freedom, and that kind of thing. Those
Right.
are the kinds of things that those are the kinds of symptoms. And what I usually say to parents right off the bat, because oftentimes they frame this as bad behavior that needs to stop.
Right.
I've tried everything. I've punished, I've taken things away. And usually what I do is I say to them, think about a symptom, a behavioral symptom, as coded communication, a distress signal.
Mm-hmm.
That and like any distress signal, that it's the body or mind's way of saying, help me. And if we don't decode that, and I say this is my job, is to help decode the behavior.
Yeah.
And if you don't decode it, if you just simply find clever ways of stopping it, what happens is that it shows up in some other area.
Right. Right.
Invariably.
Yeah.
Yes.
Yeah.
Yes.
I feel like a couple of things that you just spoke to. I wanna underscore. The first is the one you just said, that idea of like the behavior. Think of it as a coded communication.
Mm-hmm.
Think of it as a way of saying like, this is a problem. Let's address the problem. I think that that's another thing that makes a psychodynamic therapy different from the others, is that when we practice this way, we kind of read, I suppose, or think about most things as a potential coded communication about what's happening on a deeper level. I remember once in a community mental health clinic where we were very focused on cognitive behavioral therapy. Somebody was talking about a client they worked with who was dealing with some psychosis, some hallucinations, and some delusions. And this client would say things that would be, everyone would be like, whoa, they said that, crazy. And I was in the consult group and I said, well, maybe they're saying this. And someone in the group said, oh, it sounds like you're interpreting their psychosis as a coded communication. Or they used another phrase for it. I don't remember what. Covert communication, I think is what they said. And I remember being like, yeah.
Yeah, yes.
Isn't
Yeah,
that what we do?
That's what we do. That's
And-
exactly what we do. Yes.
And everyone else is like, no.
No, that's not.
No, that's nonsense.
That's
Psychosis
nonsense.
is nonsense.
Yeah.
And that's a difference. And
Yeah.
it's just a different way of thinking.
Oh yeah. Oh, it's like if somebody has exhibits paranoia. If you listen to the paranoia, there's always an element of truth to it.
Yeah.
It may be distorted,
Mm-hmm.
but rather than trying to convince the person that that they're wrong, it's like I think our job really is to try and understand the core concern, and that oftentimes when a person feels understood, that some of the distortion goes away, some of the exaggeration. The people sometimes need to exaggerate in order to be heard.
Mm-hmm.
Yeah.
Sometimes I think about how if someone is trying to describe a really big feeling, they'll say, it felt like I got stabbed in the chest. And if you're that's a pretty developed thing to be able to say.
Yeah.
It felt like is a really complicated phrase to hold in your mind.
Yes.
And especially if you're an adolescent who I tell parents adolescence is such a mess because your entire nervous system is rewiring end to end, and so many things are changing so quickly. It doesn't feel like I'm getting stabbed in the chest. I'm getting stabbed in the chest. And a parent listening to this with a especially sensitive kid might have a familiar experience of the child saying, "Stop yelling at me," when you're like, I am literally I am whispering right now. What do you mean yelling at you?
Yes.
Because they are
experiencing it as yelling. Yes.
Exactly.
Experiencing it. That's what. Yes.
And they're not psychotic.
Yeah.
They're just communicating in a developmentally appropriate way.
Exactly.
That to an adult sounds like exaggeration.
Exactly. Yeah.
The other thing you mentioned that I wanted to underscore was this idea of this is just a general therapy advice thing that I try to tell people. Anyone who says my theory and my therapy can treat and cure anybody is, I don't think, practicing in the best manner.
Yeah,
I'll put it that
it's
way.
Grandiose.
Yeah.
Yeah.
Yes. And I love that you mentioned OCD specifically, because kind of famously, listener Freud wrote a really famous case study about the rat man, who is someone who we would diagnose with OCD today. So a sort of analysis of OCD is pretty deep in our theory, going back to the founding guy.
Yes.
And research has shown over and over and over again that psychoanalysis or psychoanalytic or psychodynamic therapy doesn't help reduce the distressing symptoms of OCD.
Yeah.
Psychoanalysis or psychodynamic therapy can be really helpful for making sense of a life of OCD in the same way that a psychodynamic therapy can help people make sense of all kinds of lives.
Right.
But if the goal is to make the distressing symptoms go away, which I think is an important goal to have, then this isn't the right treatment for it.
It isn't the right treatment, right? And that's different than a person who exhibits mild OCD. I mean, because we all do.
Yeah.
And then I think we have the luxury of being able to explore that. But if a person's symptoms are absolutely preventing them from functioning, they need something. I like to think of it as it's a little bit like if somebody comes in and regardless of the age and is saying they want help with weight loss, they're still going to have to go exercise, and they're still going to have to go perhaps to a dietitian to find out.
Right.
But I can help them understand. I'll say in general, a psychodynamic psychotherapist can help them to understand maybe what is motivating them, but they still need to rely on tools, so-called tools out there. Yes.
Mm-hmm.
One of the things I wanted to mention also, and I don't want to get ahead of you here, I don't want to
move this so that it's picking you up a little bit better because it's missing you. There we go.
Oh, thank you. I don't want to have this end without talking a little bit about a common question that parents ask me about what happens? What happens if I, the parent, decide, you would be a good fit for my son or daughter, but, but I don't think my son or daughter is interested.
Uh-huh.
Is that what I will say? Is I will say to go home and to say to your son or daughter, you are not. I am not asking you to commit to this for the rest of your life. I'm asking you to go in one or two times and make a judgment about whether you think it could be useful. If you break it down that way, that in 99% of the cases that if you don't require that sort of commitment, adolescents will do it one time or two times, and usually at the end of that first session, I'll say, "Hey, you want to talk some more next week?" Okay, and they'll do it. The other thing is another question that parents often ask me is what do you do? What do you do if a kid doesn't talk? Because a lot of teenagers come in and they won't talk. I had a kid, for example, that came in and would fall asleep on me as a sign of defiance.
Yeah.
And I've decided that, and I often will tell my consultees this, is that you have to learn to love defiance. If you don't like defiance, then you're going to get into a power struggle. But if you enjoy defiance, which I happen to do because part of me is still a teenager,
Yeah.
is that you go with it. So, for example, with one of the kids that I'm thinking about, he would come in and he would be very nice and he would smile and say hello, and then he'd fall asleep. And so what I decided to do is, rather than panic, because his parents are going to just love that he's sleeping in the session, is I decided I would pretend I was him, and I would have a conversation with me, and I would say, I'd say, let's pretend the guy's name was Junior, okay?
Great.
And I'd say, so Junior, how was your week? And I pretend to be Junior, and I'd say, oh, my week was just fine. How was yours, Don? And I would go on like this, and before you know it, the kid started to giggle and laugh, and before you know it, he woke up and he engaged.
Yeah.
Another kid once decided, I don't think I want to be here. I'm going to leave, and he goes to my door. And I'm sitting here in a little bit of a quandary. Now, what in the world am I going to do? It's not like I can stop him from leaving. And so what I said was, playfully, I said, well, you can leave, but before you leave, I have to de-electrify the door here. And he stops and he says, that door isn't electrified. And I said, oh, no, it is. Now, by the way, this not a psychotic kid, so he was able to join the play,
right?
And so we just spent the first half of the session playing, and I kept looking for the button so I could turn off the another kid. I'll give you one more example. Another kid, I love this. Another kid came in and fell asleep on me, refused to talk, and so what I did, I happened to know her cell number, and so I texted her, and she woke up. And then she texts me back, and then she falls back asleep, and then she texts me back. And before you know it, and this is the beauty of sort of allowing defiance and not getting threatened by it, before you know it, started texting me pictures, very serious pictures of what it like to feel like her based on things she had found off the internet. So there are all kinds of ways to deal with kids who are resistant to therapy, but you kind of have to enjoy it.
I feel like I keep coming up with two things I want to talk about after everything you say, but there's like two like concepts that feel really important for work with adolescents based off of what you're describing. And the first is you came up at the very beginning and then again now, which is the idea of a power struggle and how power struggles are like to be avoided. In therapy.
Yes.
Power struggles are inevitable in adolescence.
Yes.
Like they need power struggles with parents, with teachers, sometimes with police, or just the security at the local QFC or whatever. But like adolescents are figuring out what it means to have the power they have.
Yes.
And some of that's social power and some of that's physical power. And it's a messy, confounding thing. And what I'm hearing you say repeatedly is you avoid those.
I absolutely avoid it, because otherwise I'm just going to do what the parents are doing. And
Right.
parents, for parents to have me do with their kids what they're doing, they would have a right to say, what's the difference? And I try to I try to share that concept with parents. And what I will say to the parents is, think about a power sharing arrangement. I'll say is that, and you can start that actually in toddlerhood.
Sure.
And you do that, and some people say, well, how in the world can you share power with a toddler? Well, the way it's done with a toddler is often, you give them a choice. You can go to bed in 5 minutes, or you can go to bed in 10 minutes, and they'll
Right.
choose 10 minutes. It's more sophisticated with teenagers, of course.
Sure, because they'll see through it.
Yeah, they'll see through it very quickly. And so the power struggles that come up is not so much about, what they're going to do or not do, but who's going to prevail in the session.
Right.
Are we going to talk, or we're going to not talk? And so one of the ways that I give kids power, or share power with them, is I give them plenty of freedom to be with however they want to be. And to accommodate, to their sort of, worldview of, that adults are stupid and
Yep.
and that we don't know anything. And rather than insisting that, you should listen. I've been here, and I know how it works in life.
Yeah, let me tell you, when you get older.
Yeah, when you get older. Yeah.
That's a thing to avoid.
Yeah.
The other thing that feels really important is what I think playfulness and how that stands in contrast to playing.
Yes.
Because sometimes you do play with
Yes.
adolescents. Sometimes you play with adults.
Yes.
But there's this playfulness that's
Yeah.
more of like a persistent like attitude
Yeah.
that feels really important,
Yes.
which at least in how I think about it, playfulness is a great way of kind of like taking the edge off a little bit.
Yes.
Because you're dealing oftentimes with like emotional experiences, affects that are like really, really overwhelming and really, really powerful. And playfulness around them allows us to speak honestly about them and even like get right up next to them without being like absorbed and obliterated by it.
Exactly. Play. I'm glad you brought that up, because play. One of the things that Freud said is the difference between play and reality is that play and reality are serious, but reality is real. And in the context of playing is things are as if.
Yeah.
And so, for example, I will often be self-effacing and pretend to be sort of incompetent, but it's more like as if I'm that way. I'm not really, because there is a certain competence. The paradox is that if you very consciously engage in a certain amount of self-effacing, a mild amount, it's that the paradox there is that there is a certain level of competence that you're exhibiting, but you're pretending to be incompetent.
Right.
And it's serious stuff, but it's not real. And that's what the difference was, according to Freud, between playing and non-playing. It's not about reality. It's about or it's not about seriousness. It's about what's real and what's not real. That's one of the reasons why when we watch a movie or read a book is that we're suspending disbelief. We know what's real. We know what's real. They know what's real, but we're pretending as if it isn't. With a young child, it's more imaginative play, and it's more and you incorporate objects into the play, as you know. Yes.
Yeah.
This doll, this mother doll, and this father doll. We both know they're not real, but we pretend as if they were real, and this is as if they had a voice.
Yeah. And as you were describing that, I was thinking about how much adolescence is about playing the as if, and playing as if they already are the thing that they're going to grow into. That's like, I think about I really like, speaking of movies, I really like the movie Rebel Without a Cause as like a brilliant little encapsulation of adolescence, right? And it fits, like, at the time there was a cultural obsession with teenagerness, and and James Dean is an incredible actor, but like the scene that comes to my mind is the scene where these three sort of disenfranchised kids who are somewhere between child and an adult, whose parents treat them in some ways too much like children, in other ways too much like adults, go to an abandoned house and they play house together, where the James Dean pretends to be the father, and Natalie Wood pretends to be the mother, and is it Sal Marino? I don't remember. The other kid pretends to be the child, and they're all taking on, in this playful way, these roles that they're actively trying to grow into at the same time. And like, I think there's a lot of adolescence that's about that. And sometimes the line between, am I playing as if, or am I really being this, is deeply confusing. And I think that stance of playfulness sort of helps keep it safe. Keep it safe enough to explore.
Keep it safe to explore. The same way that when kids play with like army trucks or with dolls or something, it's they're suspending disbelief. It gives them an opportunity to explore possibilities. And I think that's also applicable to adults. Is oftentimes when an adult comes in and says, I could never do such and such, I say, well, let's pretend for a moment. What if you were? Well, how would it start? You don't have to do it or anything, but let's pretend for a moment that you were going to set out. It might be something as somebody once said to me, I could never get a divorce. She was miserable in her family. I said, well, if you were going to get one, what would be the first step you would take? So in a sense, that's playing with possibilities.
Right.
Yeah, it's moving beyond the concrete.
Yeah.
That you can do it or not doing. By the way, I wanted to mention to you, it is totally out of sequence, but we were talking very early in this podcast about adolescence and separation, and toddlerhood. That there is a very famous author, Peter Bloss, who actually designated adolescence as the second separation and individuation stage. The first being toddlerhood.
Right.
Yes.
Yeah. And
I forgot to mention that. Yeah.
For our listeners who might be less steeped in the developmental stages of psychoanalysis, in the first separation individuation stage is about a child experiencing themselves as an individual at all. Like before that, it's your relationships.
Yes.
And then you start to realize, oh wait, mom and dad aren't in my head. Like I have a whole separate being. Whoa.
Yes.
And
exactly.
And adolescents are doing that again.
Yes. Yeah, doing it again. They're refining it. Yes.
Yeah.
Yes. Yeah. Margaret Mahler wrote a book in the 70s called The Psychological Birth of the Human Infant. And she goes through, you may know about this, as a series of stages beginning with a symbiotic essentially a symbiotic stage, and then the stages of coming into their own and being able to, what she called, achieve the stage of object constancy, which basically means I can carry around the relationship in my head. I don't have to be physically present.
Right. Yeah. Oh boy. And that ties into a lot of the work that we do as therapists, and a lot of how people grow. And I feel like we could talk about this for another 4 hours easily. And I want to respect your time and our listeners' ears. If a listener has heard this and would like to find you, either a parent who's looking for therapy for a kid, or another professional who's looking for consultation or to take a class, where can you be found?
I can be found very easily by emailing me. Should I give that email address?
Yeah, and it'll also be linked in the show notes. You can say it as well, though.
It's dschimmel@comcast.net. They're also welcome to call me at 425-775-2205. They're welcome to call me, and even if it's just to get a referral. Oftentimes people will call me. I won't have an opening necessarily, but I'll be happy to hook them up with somebody that I trust. That's good. And in fact, that's a lot of what I've been doing lately, is just simply helping people get connected with people that are like-minded. Yes.
Yeah.
Yes.
Especially as we're coming out of the pandemic and sort of moving into whatever stage we're in now.
Yes.
A lot of new issues are coming up. So there's
And they
always
can
more
also, and if they're also interested, like in taking a course, I am going to be. In fact, it's listed right now. It just came out last week. I'm teaching a class through the Northwest Alliance for Psychoanalytic Study. It's the third or fourth time that I've taught it. It's called, now this isn't specific to adolescents, but it's called Working with Narcissistically Vulnerable Clients Through the Lens of Self-Psychology. But I'm also, in the spring, I'm slated to teach a course on how to work with adolescents.
Great.
And their parents. Yeah.
Also through the Alliance.
Also through the Alliance.
Okay,
yes.
awesome.
Yeah.
And that's where we met, was
the
class that you taught at the Alliance.
That's
on
right.
Working with kids.
That's right. Yes. Kids and adolescents.
Yeah. And that was in 2020. So most of our conversation was like, how do we even do this now that we can't see each other?
That's right. That was during the beginning of the pandemic.
That was an interesting time.
Ooh, ouch, yeah.
But anyway, thank you again.
Thank you
for coming on the show. And I hope we have you back at some point, because I feel like we could go deeper.
Anytime. Yes, anytime. Been a pleasure.
Special thanks to Don Schimmel for coming on to this episode of the podcast. Don's email address is in the show notes. If you would like to take a class from Don, he often teaches at the Northwest Alliance for Psychoanalytic Study, which is also linked in the show notes. The Relational Psych podcast is a production of Relational Psych, a mental health clinic providing depth-oriented psychotherapy and psychological testing in person in Seattle and virtually throughout Washington state. If you are interested in psychotherapy or psychological testing for yourself or a family member, links to our contact information are in the show notes. If you are a psychotherapist and would like to be a guest on the show, or are a listener with a suggestion for someone you'd like us to interview, you can contact me at podcast@relationalpsych.group. The Relational Psych podcast is hosted and produced by me, Tyson Connor. Sam Claney is our executive producer, with technical support by Ali Ray and the team at Virtual Ally. Carly Claney is our CEO. Our music is by Ben Lewis. We love you, buddy. Someone you'd like us to interview, you can contact me at podcast@relationalpsych.group. The Relational Psych podcast is hosted and produced by me, Tyson Connor. Sam Claney is our executive producer, with technical support by Ali Ray and the team at Virtual Ally. Carly Claney is our CEO. Our music is by Ben Lewis. We love you, buddy.